Dr. Wilkins, we know that nitric oxide is such a wonderful healing nutrient for the endothelial lining and the blood vessels. But can you tell us a little bit more about how it impacts the immune system and the nervous system?
Sure. Yeah. So you got the endothelial derived nitric oxide synthase. You got the INOS, which is inducible nitric oxide synthase, and NNOS, which is neuronal nitric oxide synthase. So nitric oxide, as you can see, is very ubiquitous and does so many things in the body. Yes, you talk about cardiovascular issues, you better be thinking nitric oxide, whatever the issue is, high blood pressure, atherosclerosis, enlarged heart, you name it, you should be thinking about the cardiovascular benefits of nitric oxide. But yes, it does go much deeper than that and more far reaching. Nitric oxide has been called the miracle molecule for a reason. Unfortunately, when we hit about 50, we're making about 50% that we did when we were 20. And so when it comes to inflammatory issues, nitric oxide is key to help to reduce the inflammatory process. It does help for pain issues. When I first got involved in this in 2005, my primary interest was for cardiovascular benefits. And we would help people by putting them on arginine-based nutrition. And sure enough, their cardiovascular issues would get better. But then they would come back and they'll say, you know what, I don't have to take my pain medication anymore. Is there any connection to what I'm doing and my pain? And I said, well, I would think so, but I didn't really know until I did the research. And sure enough, morphine actually works because of nitric oxide. So there's a great example of somebody being in severe pain and being out of pain because it creates nitric oxide on the nerve endings and it causes the pain to then go away. So there's an extreme example there of showing of how beneficial nitric oxide is with regards to pain and inflammation. And then also, I think you mentioned the nervous system. Well, nitric oxide is also a neurotransmitter. And so we also, once again, people in their 40s, 50s, and above, they knew their nitric oxide levels were low, whether they're having cardiovascular issues or not. They would start using these nitric oxide precursors, the arginine, citrulline, and the antioxidants. And once again, they would say, my depression has gone away. My anxiety is better. Is there any correlation? Well, sure enough, there is. Again, nitric oxide is a precursor to all your happy chemicals. Your serotonin, dopamine, acetylcholine, all those stem from nitric oxide. So they're very much, nitric oxide is important with those issues as well.
And it's an immune modulator too. So it can be great for things like any kind of autoimmune, scleroderma, asthma.
Absolutely. Yes. So again, fantastic results. It's not an immune system stimulator. It's an immune system modulator. So yeah, all those autoimmune type issues, you do the research, as you mentioned, Google search nitric oxide, scleroderma, or asthma, or whatever it is that you want to look at. And you're going to find information that shows a favorable response from boosting nitric oxide and that issue. But also, yeah, with regards to just immune system in general, things like cancer, because nitric oxide facilitates natural killer cell production and activation. It activates T cells, B cells, all those soldiers that are in our body to help us to be able to disarm and disable the bad guys. So it works again in supporting those cells. They need nitric oxide to be able to float around and do their job. And they also use it to disable the bad guys. So that's what you want, right? You want your immune system to be at its optimum. You want it to be modulated. You don't want it to be overactive, underactive. You want it to be able to do its job. And that's what nitric oxide has been shown to do.
Fantastic. Thank you.